Cass Nelson-Dooley here, talking with you today about inflammatory bowel disease. What is inflammatory bowel disease? It is just what it says, inflammation in the gastrointestinal tract. And what comes with it? A lot of terrible symptoms, things like frequent diarrhea, abdominal pain, rectal bleeding. Because of the inflammation in the gut, there can be malnutrition, anemia, fatigue, exhaustion, and the inflammation can spread from the gut out into the joints. So there can be joint pain, back pain. You can feel pretty miserable. And we're going to talk about a case today, an integrative and functional medicine approach to Crohn's disease that turned it around within 6 months. But before we get into the details of that case, let's just talk about what are the normal treatments for Crohn's or ulcerative colitis. Well, they're not that great. I really don't believe the current treatments for Crohn's and ulcerative colitis are good enough. And I think we need to insist on getting better options. So the current treatments are immune suppressing medications. And that is basically to turn off the immune system so that the inflammation stops. However, they carry a lot of risks. And you continually have to get stronger and stronger anti-inflammatory medications involved because the immune system doesn't want to stop creating inflammation. And once you go up and up and up in your strength of immune suppressing medications, then there's nothing left to do. And surgery is used. Surgery to remove the diseased portions of the GI tract. And the problem is that, for instance, in Crohn's disease, surgery hardly helps. 1 in 2 people will still relapse with Crohn's. So these aren't curative solutions. These are Band-Aids. These are symptom managing treatments. And there are good solutions out there, and they are available through integrative and functional medicine. Integrative and functional medicine is looking at this disease through the lens of what is the cause? Why do we have inflammation? Why is the immune system on red alert? And once you address those root causes, then the body settles down. The immune system relaxes and does what it's supposed to do instead of attacking your own body or the host. So what are some root causes, potential root causes of inflammatory bowel disease? 1 is diet. It's extremely important. 2 are food sensitivities and allergies. 3rd is gut microbiome imbalance. Imbalances of the gut microbiome are very common in inflammatory bowel disease. Infections, they can be in the gut or they can be systemic infections. And then malnutrition is a potential root cause. And finally, intestinal permeability or leaky gut. So these are some very common root causes of inflammatory bowel disease, and we see patients get better all the time when we address these fundamental problems. So let's go over an example case. And this is a real-life patient who got a total turnaround of her Crohn's disease. Her name is Roxanne for our case, and she was a 45-year-old female. She was in a terrible, vicious cycle of diarrhea, C. diff infection, and antibiotics. She and her doctors could not get her out of it. They really couldn't figure it out. It was going on for years. And after she would take antibiotics for difficile, Clostridium difficile, the pathogen that causes bloody diarrhea, after she would take the antibiotics, it would go away. But the next time she got antibiotics for any other reason, boom, she was back into this cycle and she had C. diff again, and she was very sick again. Now, she also had abdominal pain, rectal bleeding. She had gas and bloating. She was tired. She was feeling really worn out and miserable. And she did eat a standard American diet. So plenty of junk food and processed foods and lots of bread and dairy and meat and starches and not enough vegetables and whole foods, although she did like salads. So the first thing that was done, and this was it. The last time she had been to her doctor, they had done a colonoscopy and said, "We're sorry, but we think you have Crohn's disease." So she was upset by this, and she wasn't very interested in going on Remicade for treatment. So she sought out an integrative and functional medicine doctor to help her look at other potential causes and treatments that might not have as many side effects. So most important tool that this clinician used was the GI map, a stool test from Diagnostic Solutions. And it found that, of course, her microbiome, her good bacteria were very low and depleted, as we would expect after antibiotics. And also she had some gut infections that had been missed by the other tests, Klebsiella and Pseudomonas. And you can read about this in the blog that I wrote. So her clinician, her functional medicine doctor, prescribed her a diet free of allergens, free of the top allergens. Also asked her to eat foods that would build her microbiome. She gave her high-dose probiotics, antimicrobial herbs such as Happy Belly from Metabolic Maintenance, and also enzymes. And Metabolic Maintenance has a product called Gludazyme. So with this treatment, Roxanne started feeling an improvement in a record 11 days. Within 11 days, she had a normal stool, which was, she felt, the first time in forever. She also very quickly stopped having as much abdominal pain. And she had been on medication for the abdominal pain, which she was now able to just leave off because she no longer needed it. Within another month or two, all the abdominal pain was totally gone. Her doctors were urging her to come back for treatment and monitoring because of her serious condition, but she was getting so much improvement that she just held off a little longer before she went back to see them. She started losing weight in a healthy way. She was eating a lot of food, but she was still losing kind of a pound here and there and was feeling like she was at a healthier weight. She had better energy and she felt her mood and her brain kind of clear. She was thinking more clearly and able to do more. She said, I'm feeling great and I'm looking pretty great too. So she was on a great track of progress. And when she went back to get her follow-up colonoscopy 6 months later, there was no sign of inflammation. There was no sign of Crohn's disease. And they told her there was nothing to worry about and she could come back in 5 years. So this was a dramatic success story, a rapid success story, and a very exciting story where we see how addressing simple things like diet and supplements and looking for root causes can really turn off inflammation in the gut. So if you'd like to learn more, please check out my blog where I go into this case in detail, Stop Diarrhea, Abdominal Pain, and Crohn's Inflammation with an integrative and functional medicine approach. It's a case study. You can find that at my website, healthfirstconsulting.com. And I have another blog on inflammatory bowel disease because this is a topic near and dear to my heart. My grandmother had Crohn's disease, and it's called Ulcerative Colitis and Crohn's, Address the Root Causes of Inflammation Without Medications or Surgery. So please check those out if you're interested in this. We can really change the world and improve human health by looking at root causes and not just treating the symptoms. Thanks so much. Talk with you next time.